Neurology for Semester 10 Faculty of Medicine. 1. Stroke. A definition and epidemiology. Definition of stroke. Stroke is a medical emergency condition that occurs due to impaired blood circulation in the brain, either due to blockage, ischemic stroke, or bleeding, hemorrhagic stroke, which causes damage to brain tissue. Stroke classification. Ischemic stroke, caused by occlusion of a cerebral artery, often due to thrombus or embolism. Hemorrhagic stroke. Intracerebral hemorrhage, IC, due to chronic hypertension. Subarachnoid hemorrhage, SAH, is generally due to ruptured aneurysm. Cryptogenic stroke. Stroke with unknown etiology despite a complete diagnostic examination. Global epidemiology. Ischemic stroke is more common in developed countries due to sedentary lifestyle, obesity, and dyslipidemia. Hemorrhagic stroke is more common in developing countries, often associated with uncontrolled hypertension. Global incidence. Stroke is the leading cause of disability and the second leading cause of death in the world. B. Pathophysiology. Ischemic stroke. The process begins with cerebral blood vessel occlusion, right-pointing arrow tissue ischemia, right-pointing arrow cell death in the infarct core area. Penumbra zone. The area around the infarct core that can still be saved with early reperfusion therapy. Hemorrhagic stroke. Bleeding causes local pressure on brain tissue, inflammation, and edema. Toxic effects of free hemoglobin. Triggers oxidative stress and additional tissue damage. Brain response to injury. Microglia activation. Increases inflammation in the area of injury. Neurogenesis. Limited to certain areas, e.g., hippocampus. C. Diagnosis. Physical examination. NIHSS, National Institutes of Health Stroke Scale, score to assess stroke severity. Imaging. Non-contrast CT scan. Primary modality to differentiate ischemic from hemorrhagic stroke. CTA, MRA, identifies stenosis, occlusion, or aneurysm. MRI diffusion weighted imaging, DWI, highly sensitive detection of acute infarction. Biomarkers. NFL, neurofilament light chain, marker of axonal damage. GFAP, glial fibrillary acidic protein, helps differentiate hemorrhagic from ischemic stroke. D. Stroke management. 1. Ischemic stroke, reperfusion therapy. Intravenous thrombolysis, TPA, should be given within 4.5 hours of symptom onset. Mechanical thrombectomy, for large artery occlusion, can be done up to 24 hours of onset. Experimental neuroprotection. Compounds such as edaravone are being studied to prevent oxidative injury. 2. Hemorrhagic stroke, blood pressure control. Targets systolic pressure less than 140 millimeters of mercury. Surgery. Evacuation of hematoma in cases with significant mass effect. 3. Rehabilitation and monitoring. Functional rehabilitation. Robotic technology and virtual reality-based therapy. Home monitoring. IoT devices for early detection of recurrent stroke risk. 2. Epilepsy. A. Definition and epidemiology. Definition of epilepsy. Epilepsy is a chronic neurological disorder characterized by recurrent seizures without a provocative cause. Epidemiology. Global incidence. An estimated 50 million people live with epilepsy. Age factors: in infants, metabolic encephalopathy and hypoxia. Adulthood, head trauma, stroke, or brain tumor. Social burden. Patients with epilepsy often face social stigma that affects quality of life. B. Pathophysiology. Seizure mechanism. Abnormal neuronal excitability. Decreased GABAergic activity increases the risk of neuronal hyperactivity. Excessive synaptic plasticity. Long-term potentiation, LTP, contributes to abnormal activity. Genetic mutations. Dravet syndrome. Mutations in the SCN1A gene. Tuberous sclerosis. Mutations in TSC1, TSC2. See diagnosis. Clinical examination. History of seizures and triggers. Complete neurological examination. Imaging. Brain MRI. Detection of structural lesions such as tumors or cortical malformations. PET scan. Identification of hypometabolic areas. MEG. Location of focal epilepsy. Biomarkers. S100B protein and inflammatory mediators, e.g., Illinois 6, in cerebrospinal fluid. D. Epilepsy management. Pharmacology. Anti-epileptic drugs, AED, monotherapy, lamotrigine, levetiracetam. Polypharmacy for refractory epilepsy. New drugs, brivaracetam, safer with low side effects. Non-pharmacological therapy. Neurofeedback, brain activity control training using biofeedback. Ketogenic diet, proven effective in refractory epilepsy. Surgical intervention, functional hemispherectomy, for extensive damage. LIT, laser interstitial thermal therapy, minimally invasive. E. Prevention and rehabilitation. Epilepsy, public education to reduce stigma. Use of wearable devices for early detection of seizures. Stroke, flavonoid-rich diet for prevention. Robotic rehabilitation technology to accelerate recovery.